I'm Michael Bilbrey, the president of the California School Employees Association. We have over 210,000 members across the state of California. They are non-teaching positions in our public schools. More than half of our membership is part-time employees, and they either don't get health care, that's not part of their benefits, especially if they work 4 hours or less a day. And those who do get benefits oftentimes are now, because the costs have become so high, at the end of the month, turning around and signing over their check and giving it back to the district for their health care, or they're writing a check to offset, depending on how much their benefits are. So in reality, they're only working to get their benefit and not for anything else other than that.
I mean, it seems like there are a lot of negotiations. Workers are being told, the unions are being told, you have to take pay cuts to pay for your health care. Is this going on?
So in education, over the last 5 to 7 years in regards to the education budget, we have had cuts. We have had layoffs. We have lost, actually, over the last 5 years, 20,000 members due to budget cuts. And so in negotiations, we have not seen any type of raises, and always healthcare is the number one issue that comes on the table. And increasingly, there is additional now wanting them to do more co-pays, more out of pocket. It's just an additional expense constantly to the worker. And so it has just become, it's for some, that they can't afford to do it. And actually, some have actually had to leave their jobs because they just can't afford it. We would have people who would increase their living wage. They would actually not have to any longer think about, do I put food on the table, or do I buy medicine for my child? Do I have a home, or tomorrow maybe I won't have a home? It's taking those big life-threatening things for them in their everyday life and making those decisions, and they won't have to do that if they actually have a living wage which is able to be put on the table in negotiations, and not always being healthcare the number one issue.
So this is for all workers?
It's across all workers. It's not uncommon just to us. It's all workers that have this issue. Some are even worse than we are.
I'm Gladys Ibo from Minnesota Nurses Association. So this morning we talked about the issues of single payer, and we learned so much how we can start to save money from everything that's happening now and what to use that extra money to tackle the other social issues, such as issues with homelessness, issues with providing housing for the poor, and looking at the infrastructure of the whole environment. So it's really a goal that we are shooting for, forming all these coalitions, connecting communities, and actually speaking up for the benefits that lies within. It takes money, it takes efforts, and we are going to organize like never before as soon as we get back to our state, which is state of Minnesota.
And is there a healthcare crisis in Minnesota?
Oh, there's huge healthcare crisis, and as nurses we see it every day that we go into practice. I mean, it's just there at the forefront that you cannot even deny it. I mean, if our HMOs and everyone that the CEOs are blinded from seeing what is going on, we as nurses are standing strong to keep pinpointing and saying this cannot happen, there has to be a change, because we feel that moral duty to the people that we serve, and we have to advocate for the patients all the time.
And specifically, what kind of crisis is there? Why is there a crisis?
Well, there's crisis because the poor cannot afford to go to the hospitals when they need it. There's prevention that we know helps to sustain people and maintain their livelihood, but because it costs so much and they are taking away money to pay for the insurances, so they're not even feeding their families. And so we see that as crisis, and quality of living is really poor across the whole state. So you see it at every single place that you go to practice, and why people are not seeing this, it's beyond me, but we are standing strong to keep speaking up until something is done.
I thought Obamacare was being implemented in Minnesota.
Yeah, but it has its deficits. Surely it has helped some, but all these expectations that we thought is going to happen are not happening, because it's creating more. It's creating more poverty. It's creating more.
Creating more poverty.
Yes, it's creating more poverty because the payouts when people get treated is higher You know, even though you pay into an insurance company, when the care is given, the aftercare cost is higher. So even though you have insurance, the protection actually is not there because your out of pocket payment is even going up higher. We know that for sure.
So it's not like Medicare or
So
Medicare or
it's
something.
not. That's why this is the key. That's why we are speaking out, because Medicare for all, single payer movement is the goal, because there has to be a way to cut across all this. Money saved will be used into looking at other social issues that confound people.
Doesn't that mean getting rid of the insurance companies?
Well, yes, the insurance company we know are going to fight this movement. We know they have the dollars. We know they have the capacity. But we have to start preparing and build up the grassroots. This is like a big coalition, and we need to connect to the leaders. We need to speak to the people's hearts, because when people feel what we feel as nurses, the movement is going to be higher, and then we're going to get this
Now, is
passed.
nurses' healthcare under attack as well?
As nurses here, healthcare is under attack hugely, like never before. I mean, in the 1980s, we thought there was issues, but now the issues are even compounded with all the steps that have been taken. You know, you can see the trend. You can see the trend that not even though we're fighting for more, it almost looks like we're going backwards.
Well, how are nurses being affected? It's supposed to be better. You're saying
Well,
nurses are actually...
yes, nurses are being impacted because we know and we feel the acuity level, which is the number of cares that a patient needs, is higher. And so the time to actually care for these individuals is being cut back. And so the fight against working overtime, nobody's looking at the acuity level. Nobody is looking at the step-to-step things that you have to do in your shift period. So, and you're taking care of a human being. So when there's a human being to be taken care of, you cannot bet for timing. You cannot say this is your standpoint and this is your endpoint. You need to care for the individual, and that takes up time. And we need to be allowed to use our judgment and care for the individual at the level that we need to care for them.
And that's not happening?
It's not happening, but we're speaking up. So we're beginning to see rudiments of it, some changes, but we need to continue to fight, because if we draw back, it's going to go back to where we were before. So we need to step it up.
So are you disappointed about Obamacare?
I wouldn't say it's a disappointment totally. I think everybody is trying to figure out what needs to be done, you know, and that was one step that was taken, but we see now that it's not cutting across all the problems, so something else is needed, and that's why we're looking for the single payer movement.
Now,
I'm from third world country. I'm from Nigeria originally, and so when you look at what's going on in the United States, it's almost frightening, because if the level of care is depreciating here, think about what it would look like back home, where there's no health care existence. I mean, there's nothing to care. We worry about this Ebola virus that's killing many people now. It's going globally. It's traveling the whole world. So we need to step up preventive modes. We need to step up these modes, and we need to figure out a way to put them in placement and ways to fund them.
well, isn't the United States government pushing privatization of healthcare in Africa and around the world?
I know, because, you know, they think that that's the way. Well, that is a sure way of pocketing some of the monies that could be channeled to issues that we see. The infrastructure. I'm from Minnesota. There was a bridge that collapsed. Many people died. Many people were injured. If people paid attention to those local infrastructure decay, you know, I mean, it's all adds to the quality of life. So, I mean, once you touch up one issue, it opens up lots of issues. And we cannot stay blinded to this. As nurses, we have to step it up. We have to come to the forefront. We have to communicate to people's hearts. We have to start seeing changes be created, and we will demand it. We will demand it to happen.
Well, what do you think about the United States spending trillions of dollars on military all around the world, the Middle East and in Africa, and not setting up bases there and not putting that money into it?
Yes, I know, and there's always a reason to justify movements like that, but that's their level of understanding. That's where they are, and that for somebody like me, for instance, to say you cannot do that can only go so far. But we have to start organizing from the grassroots. Changes will happen, but it's not going to happen overnight.
About labor and single payer, but I think we should keep in mind that most of the resources in the labor movement are concentrated in the building trades. And the building trades are actively lobbying Pennsylvania they're supporting Corbett, they're supporting fracking, they're supporting drilling, the building trades are supporting the tar sands pipeline. A house divided cannot stand. We need vision. The coal miners are out there lobbying for mountaintop removal, and it's insanity. We need some vision at the top of the labor movement. We need somebody to say, look, when you learn how to drink money, breathe money, grow your food in money, then we can talk. But as long as you're supporting the destruction of the planet for our grandchildren, you can't consider yourself part of this labor movement.
My name is Lawrence Tebow. I'm retired ILWU longshoreman, and we're having a conference here from representatives from all around the United States to try and deal with the issue of health care. Health care, in our opinion, is a human right, and what we're concerned about is that what we take for granted as labor people, we think everybody should have the same opportunities in having a health care program that takes care of people from cradle to grave. And when we look around, we see that we're an exception to the rule. And we want to expand the things we have to the people that doesn't have a voice. And labor union is the last organized group that can speak for the poor and the disadvantaged. And we're here today to try and see if we can increase our educational program so that we start letting the people that are locked out of health care from getting health care, not health insurance, but health care, so that they don't have to worry about feeding their family over paying hospital bills. So that's our goal, and it's a big challenge because we know that the insurance companies are going to fight tooth and nails to keep their billions and billions of dollars of healthcare costs that they're putting in the pocket of the people on the very top and offering money for health care that doesn't exist. So that's the problem we're having today, and that's why we're here today.
So are you for eliminating the insurance companies and healthcare industry?
We think the insurance companies should be out of the healthcare system. They're only interested in profit, and we're interested in healthcare and not investors. So, and the only way you can do that is to get them out of the system and create something similar to the Medicare system, where the cost is at 3%, and the insurance companies are taking anywhere from 15 to 25% off the top of each healthcare dollars to put in the pocket of the investors. And that just needs to stop.
Now, under the Obamacare plan, healthcare benefits such as the ILWU, which is very good, they call it a Cadillac plan. What's your response to the effort to say that you have a good plan and you should be taxed?
Well, the Cadillac plan is actually a nonsense. There's such no thing as Cadillac. We have normal health care, and it has nothing to do with a Cadillac or anything of that sort. We would say that it's just a regular healthcare system that should be spread out to everybody in the United States. And so these words that they're using, bronze plans, platinum plans, is all nonsense to try and divide us up into little groups to say that one group gets nothing and the other group gets everything. And that's not where we're going. We're saying if it's good enough for the ILWU, it's good enough for everybody.
And a lot of people now are having to pay premiums. They're paying, the price. There's no price control on their costs. I mean, a lot of people are having trouble paying for it.
That's one of the major flaws of the Affordable Health Care Act. It's not affordable, and there's no cost controls on how much the insurance companies can gouge the people who are least able to pay for it. And we're trying to educate the people on the grassroots level because we think healthcare is a community issue, and we want to make that clear to the community people that this kind of exploitation of the community needs to stop by exposing the amount of excessive money that the insurance companies are charging with no reason whatsoever. They have the power to do it, and they're doing it.
Now, in California, there have been some efforts to get a single-payer bill in the legislature, or ILWU, and people think that that's the way to go as far as getting rid of the insurance companies, or at least having a different system somewhere.
It's a good way, but then we found that the problem with that is that if we don't educate the grassroots people first, when the issue comes up for single payer, the big propaganda companies will convince the people that need health care most to stay with the predators, and that they will vote against their own interests because the insurance companies has all of the propaganda money to convince people against their own interests. So rather than taking the insurance companies head on, we want to educate the grassroots first so that when we do challenge the insurance companies, the grassroots won't be tricked into voting against their own interests.
Now, a lot of contracts, including the ILWU, workers are being told they have to take pay cuts in order to pay for health care, and it's affecting their actual living conditions by all the money going to the health care insurance companies. In other words, it's part of the negotiation table. How has it affected the ILWU as far as the unions fighting for their members?
Well, the ILWU is in a unique position where 3 to 5 cents on the dollar goes to pay for all of our contract language, all of it. And we have a healthcare system that's worth $1 billion. So if you look at most companies, they're paying anywhere from 15 to 25% for labor costs. We're paying 3 cents to 5 cents on the dollar for labor costs. So we're in a unique position where we don't have that pressure like other labor unions, where they're taking almost 90% of their dollars in negotiation going to healthcare costs, and sometimes all of it. And so it's just really undermining the whole process of negotiation for other unions.
You think the tide is changing in labor?
No, one of the problems with labor is that the rank and file gets very self-centered once the contract is done, where they think that they don't have, it doesn't bother me, it doesn't affect me, so I shouldn't help other people. And we have to try and educate even our own members how important it is to spread health care issues to all people.
Now, your members who are casuals on the box aren't even covered by health care. Are you concerned about that? I mean, if you work as a casual in Longshore, you get hurt, you don't really have the coverage that the A and B men have.
That's true, and that's been an issue for a long time. But you have to understand that under the casual system, you could be working or not working there. So you don't know out of the group how many are committed to working there all the time. And sometimes you have a person come there once, they get hurt, so they really haven't established a working relationship within the organization yet for the employers to say that they have a vested interest in anything. So we think that they should be covered, but the way it's set up, they're not. And it's still an issue.
And what percentage of the work being done is done by casualties?
It depends on the peak days. What we have in our industry is you have a steady flow of ships. Then on certain days you have all the ships come in on one day. So out of a month, the casuals may work 3 or 4 days in that month, which is not a lot of time, but that's the only time that they're there to take up the slack.
My name is Mike Barkley. I'm running for Congress in California District 10. As I've gone door to door, I've met a lot of people who have not been able to get their rights covered under workers' compensation. They go to their doctor. The doctor says, we can't help you because you've been injured on the job. They get sent over to a workers' comp system, and they can't help them because the administrators or the insurance companies nickel and dime them under the laws that Arnold Schwarzenegger got passed, allowing them to do utilization review on every shot or pill or treatment or physical therapy. So they're stuck in the middle. They're not getting their health care, and the people who have the obligation to pay for it are not having to pay for it. That's what Arnold Schwarzenegger did for us. What we need is to carve the healthcare aspects out of the workers' compensation system, put it in a universal healthcare system for everybody, so that these people can go get their healthcare needs met and then let somebody else go fight the workers' comp battle later. What it will do is drastically reduce the premiums for workers' compensation, among other things.
Feldblum. I'm the executive director of the Health Security for New Mexicans campaign.
And what's going on with labor in New Mexico as far as single payer?
Well, we have a homegrown plan. It's not, as Debbie Richter mentioned last night, from a state perspective, you really can't talk about a single payer, everybody in. The military, for instance, are excluded, but they are covered under their military plans. And we have tribes and sovereign nations. So we call our plan a homegrown, homespun, smothered in green and red chili plan, self-insuring most New Mexicans. Labor, the New Mexico Federation of Labor, the building trades are very supportive of our plan, have been involved for years. And recently, there is now a Central New Mexico Central Labor Caucus that is organizing for health security, which is very exciting for us, because Medicare would never have been passed without the work of unions. And we think that the same thing with the kinds of one-payer models in different states, that if labor could get on board and see it as something very important to do in the state, that it's going to help them gain the confidence of the union members, and that's what we're hearing. And it'll also help ensure that our state has a plan that's really much better than the exchanges.
Yeah, I mean, New Mexico has a lot of nuclear waste.
Oh, yes.
I mean, healthcare problems. What's going on with that, the healthcare situation in New Mexico?
Well, we are one of the poorest states. We have one of the highest rates of uninsured. Recently, there has been a problem with the waste isolation pilot project down in Carlsbad. But Los Alamos has one of the highest cancer rates, the county in the country. And of course, if you're a low-income, poor state, the chances are you have diabetes, like Native Americans have very high diabetes rates. You're not getting the kind of health care you need for preventive care. So it's a serious, serious problem around the country, not just in New Mexico, but we're a very poor state, actually.
Your anxiety's legitimate, I grant. You've been admitted for a liver transplant. Watch the nurses scurry, everybody's in a hurry. You've just begun to worry that we won't have time for you. Our time is limited, you must understand. spend the night, we gotta send you home to do the best you can. Meanwhile, we're nursing as fast as we can. We're running with bandages and bedpans. Our patients are sicker, the discharges are quicker, and the reasons are slicker why we can't afford more nurses who are nursing as fast as they can. And more cuts in nursing are planned. Oh, our pace is obnoxious and the rate is preposterous. We are nursing as fast as we can. I feel I must apologize to you. You messed your bed and had to lie in doo-doo. I was very busy, I was running in a tizzy. I over-optimistically thought I'd have time for you, but I had 7 other patients too. One of them was bleeding in his pillow. When priorities were reckoned, it was you who came in second, and first was all that I had time to do. Meanwhile, we're nursing as fast as we can. We're running with bandages and bedpans. Patients are sicker and the discharges are quicker. The reasons are slicker why we can't afford more nurses who are nursing as fast as they can. More cuts in nursing are planned. Now infection is spreading and mistakes we are dreading. We are nursing as fast as we can. We worry for our patients, yes we do. They come to us much sicker than they used to. We know we need trained nurses, but bosses watch their purses. When it's patient safety versus profit, we know what they do. Nurses who are registered must go. They hired red nurses aides because they're cheaper. We know for patients' sake this could be a grave mistake. It's a chance they take to save a little dough.